Home. It's the starting place of love, hope, and dreams. And often the best place to receive specialized health care is in-home, and that's exactly what the VNA of Maryland provides to thousands of people across our region.
That's excellent. That's excellent. Yeah. So your appetite is doing good. How's your strength feeling?
I'm better because I'm able to. When I had VNA the first time, and then when I needed to have help when the second time around, I asked for VNA. And I asked my doctor, could he assist me in getting that?
It looks really good.
And I said, doctors, who do you recommend? They said VNA. So I called VNA. They do a fantastic job, as you could see.
Visiting Nurse Association is one of the oldest home care agencies in America. It was begun in 1895. It was founded by a group of dedicated nurses who wanted to help people within the inner city. And then around 1980, the company was purchased and became a for-profit. It had been previously a not-for-profit. And in 2003, I purchased the VNA.
All right, deep breath in and out.
Nursing, physical and occupational therapy, we have speech therapy, we have social workers, nutritionists, and home health aides.
It's 44. You're regular.
The way that we impact people's lives is by helping them to change their behavior. We are successful only when we've helped a patient become independent in managing their health. We don't want patients to become dependent upon us. So we work with our patients, we become their partner. It was about 8 years ago that we realized we needed to develop some kind of programs to reduce hospitalizations among our patients.
130/62, excellent. Yeah. Healthy young man.
And we also realized that the patients that had the most hospitalizations were those with a chronic illness. So we really focused on that aspect. We focused on how we could help those patients with chronic illnesses stabilize their health. And we actually participated in a national course, so all of our professional staff are chronic care specialists.
With home care, we take these patients as they come out. We're able to work with them, help them manage their health care situation, and by the time we discharge them, they're significantly better than when we started, and we're able to actually discharge them complete.
I feel that the VNA gives me a great deal of support to achieve the goals for the patient. That if I need some help, I have a great deal of support staff that I can call on, not just from my team in the field, but I can call into the office and I can talk to my manager or to other support staff and say, we're having issues with the patient in this area. There are many background supports, even though I'm out in the field on my own and very autonomous with my function with the patient, and with my patient helping develop their own plan of care and driving it, I know that I have a lot of background support to help fill in any gaps I might come into.
So that's good.
The VNA of Maryland is absolutely a patient-centered agency. One of the first things we do when we meet a new patient is to find out what they want, and that's how we approach our care with patients. It's not based on what our agenda is, it's based on accomplishing those goals that the patient wants to accomplish.
When we go out to see the patient, we do a complete head-to-toe assessment. We're assessing medications, we're assessing any new complications. It can be anything from a patient having issues with their eyesight from a new medication. It can be somebody having some lightheadedness, dizziness after blood pressure medications have changed. A lot of patients don't realize that everything that they take, everything they do affects another system. So by going out there doing a full assessment, we're figuring out exactly what's going on. We speak with the doctor regularly. If we need to make changes, we will make recommendations, and we will do whatever it takes for the patient.
We work as a team. We talk to the nurses, talk to the other therapists, make sure they're progressing with them. We make sure that they're taking the correct medications when they're supposed to take them. We check their vital signs, make sure those are normal or stable. If they're not, we give the doctor a call to inform them so that we can continue to, as a team, make them as healthy as possible.
We look at a patient as a whole person and say, what do you need to stay independent and safe in your environment? And how can we help you achieve those goals?
I wanted to make sure that I was able to be a normal human being again. I want to be able to drive my car. I want to be able to do my own shopping. I want to be able to go to the store to get this, that, and the other, which I will be able to do after we're finished.
I want you to be able to sit down and stand up without having to use your hands, and that's what we're working on.
Yep.
My job satisfies me because I'm able to help someone regain their independence in their home. And not only their home, also getting out of the home to become an integral part of their community as well. So it makes me feel good that they are able to regain what they may have lost because of a hospitalization. Just turn your head to the left.
The VNA does keep data on the outcomes for our patients. Those outcomes are focused on mobility, on functional status, on the degree of shortness of breath they have, for example, how independent they are with their medications, and of course the number of hospitalizations that they've had.
I'm right here. You're doing great.
Medicare keeps a site called Home Health Compare, which compares home health agencies across the nation. And anyone can go onto that website and look at the outcomes for any particular home health agency. VNA is proud to have earned 5 stars as far as patient satisfaction, and that is also available on the Home Health Compare website.
It's been an absolute pleasure to work for the Visiting Nurses Association. Mr. Ray's been instrumental in making this company the way it is today. He's very sharp, adept, and he's a businessman but has a personal side to him as well, where he can really relate to his staff, being speech, OT, PT, whatever.
The people that I have met through VNA have been very respectful and very honest, and you draw close to them. And when you're sick, you want to feel comfortable with the person that you're working with, because that's important. It's very, very important to be comfortable with the people that are working with you to try to help you to come through whatever it is that you're going through. I respect that. I have a lot of respect for the people that work for VNA.
I think that's the main focus of home health, is that we don't want patients to be dependent upon us. We want to guide them to a place where they are independent in managing their health.
These people are heroes, and it's great to be around them, and it's wonderful that God has given me the opportunity to be able to run a company that focuses on making its employees and making its patients as happy as we possibly can.
Have a seat, take a break.
For more information on the VNA of Maryland, call them at 1-888-523-5000 or visit vnamd.com.